Some of you may have watched some of my videos and may be aware that I have a large series now of patients who have had chronic pain after having neck fusions performed. And a lot of the reasons for this are the fusions are done and the neck position is not perfect. So the patients continue with pain because the position of the head is not proper and the muscles are in constant pull from the base of the skull down between the shoulders, sometimes down the thoracic spine. And this is because of abnormal curves of the spine. We know now that the shape of the spine is critical and that we need to try to rematch your curvatures to what you had originally. And so when these fusions are often done, they're done improperly. And the positions are not right and patients have chronic pain. One patient of mine, a young lady, had a fusion done and had chronic pain. It was killing her. I only corrected her 10 degrees back, just 10 degrees, and she has zero pain. And this is probably 10 years now. And I still talk to her because she helps me with some other things. And she's been fine ever since. So just that simple correction matters. So what I'm doing is I'm taking these old fusions and I'm removing the fusion. Not everybody's a perfect candidate, but I assess that. I remove the fusion and place the artificial discs. And we have an excellent series of over 43 patients now, followed all almost over 2 years, with superior outcome scores and marked reduction in neck pain and restoration, full restoration of their mobility and neck motion. Now you think about it like this, the patients that have had neck fusions for a long time, what happens if you've ever broken your arm or leg and you've been in a cast for 8 weeks? They take the cast off and what's happened? Your muscles are atrophied and shrunken. Imagine what happens when your neck has been fused for 8 years. What's happening to the muscles and ligaments in the back of the neck that move the spine? They're not doing anything. They're shrinking, they're atrophying. So rehabilitation takes longer because when I restore motion, these joints and ligaments and muscles start moving again and they need to rebuild. So I tell these patients you're going to be sore longer because you have to rebuild all those muscles back. But the inevitable outcome is I'm restoring motion, they're getting their movement back, and they're very happy. One police detective I recently did at a 3-level fusion. He was in chronic pain for the last 3 years. I reversed all 3 of those fusions to artificial discs. He has zero pain. He's back working as a police detective in Pennsylvania. So these cases are real, and it will become something more of the future of reversing fusions and turning them into artificial discs.